Hey, welcome to another episode of the High Achieving Female Podcast, powered by No. Today's episode is a good one. Y'all, I'm introducing you to Yvonka Hall. She is the founder and executive director for the Northeast Ohio Black Health Coalition. This woman is self-made. She is dynamic, and she is definitely going to tug on that inner activist that you all have. We're going to hear about how she got started, how she was born for more, and how she has made it her life's work to impact the lives and give greater health and awareness to the Black population in Northeast Ohio. Get ready. It's going to be a good one. Welcome to the High Achieving Female Podcast, powered by No, where we believe high achieving female leaders deserve to be known. Here, you're going to get the tips, tools, and inspiration you need to network, grow, scale, and balance your business, career, and life. Hi, everyone. Welcome to the High Achieving Female Podcast, powered by No. I am so excited about this next guest that we have, Yvonka Hall. She is with the Northeast Ohio Black Health Coalition. And when I met this woman, she's one of our 100 women to know in America. And when I met her and heard her story, heard about all the amazing things that she was doing down there in Cleveland and beyond, I knew we had to share a story on another type of platform. So here we are. Welcome, Yvonka. Thanks for being here.
Thank you for having me.
I have to tell you, I want to kind of get into, we're talking about purpose today, finding your purpose, how you found your purpose, how you live your purpose, and how you're empowering and helping other people live their purpose. You are the executive director, the nationally recognized, and let me tell you, nationally recognized, you have some big awards and some big initiatives and things behind you here. And I want to talk about that too, but you're with the Northeast Ohio Black Coalition. And you have a master's degree. You're highly educated. You went to Notre Dame and Texas Southern. You have so much that you have accomplished in pushing your professional life forward. But I want to go back. So let's talk about the founder story a little bit. Let's talk about who you are and what led you to this Northeast Ohio Black Health Coalition.
Wow. Well, thank you, Sarah. I think everybody has a backstory, but we never get a chance to hear their backstory, because most people never take it from there. Like they have this background and they never kind of figure out what their purpose is from the background. And so when I was little, my mom had me when she was 17 years old. She was married. And then my mom and dad had 4 more children. But during that time, there was like a lot of domestic violence that went on in our household. And at one point, my mom had to flee. And in 1973, my mom got a divorce and she was starting all over again with 4 children. And so one night, my father broke down our door in our home and murdered my mom, and our lives changed forever. And so for me, I was standing there with her while she took her last breath. I was 6 years old, 2 months shy of my 7th birthday, and said, I'm going to make sure that nobody else goes through what we've gone through. And that was my promise to her. And so we all make promises, but we never really get a chance to kind of fulfill them because as a higher power is pushing us towards things, we always try to fight it. And so for me, I was one of those fighters too. Like, no, I want to do something else. I want to do something. I don't want to do that. I want to do something else. And then, what happens is, a series of unfortunate events. My younger brother was murdered on his way from school in a racial incident. And then my best friend was murdered while I was talking to her on the phone.
Wow.
And so all of those things said, this is what you got to do. This is what you were created for. And so I went to school, dug my heels in and then worked on getting my bachelor's degree. And then, started off my first journey in my job is working with people about HIV and AIDS. And then from there, doing some other work with the Heart Association, and then coming full circle to create my own organization when I looked around and saw that there was nobody representing me at the table. And it was how do we represent the best interests of our communities if our communities aren't at the table, or even know that either a table exists or that there's even a discussion, and how do we engage people who don't even understand the discussion. And so for me, since I knew that the table existed, and I was willing to, not only if the table didn't exist, Shirley Chisholm said, if they don't invite you to the table, to bring your own chair.
I love that.
So there were times when I had to bring my own chair.
That's it. I love that. Let's just stop right here, because you just dropped a major bomb on us. You shared that your mother was murdered in front of you at the age of 6 years old. And you made a vow or a promise to do everything in your power to change the trajectory for other families and other people that would be going through this or something, right? What a big deal that was at such a young age. And it's sad. And I think we could sit there and say, oh, how sad it is that you were dealt that hand. But yes, you were. And I've never heard you say, well, poor pity me. You just said, nope, that's it. And now we're moving. And that's what now I have fire to do something. Right. But I just want to acknowledge that and tell you, wow, like you've been through it at such an early age, and life could have been very different, but you stayed the course. You were educated. You went right into nonprofit to make impact. And then it's almost like kind of like you got a little bit of like experience and got your feet wet through all the things that you needed to, so that you could then run and create this amazing organization that is for, the people of color right there in your neighborhood. And how amazing is that? So before we even go any further, I just had to say my hat is off to you and the work that you have been doing. And you are so absolutely right. Sometimes you got to bring your own chair and the table to get your space. So, I think that's amazing. So let's talk about it. Let's talk about what you're doing. What are the initiatives that you're working on right now? And what have you been working on?
Wow. So if we want to talk about been working on, so when COVID hit, I had just returned from doing some policy work in California, and I get a chance to speak, all over the country. And so all of a sudden, I couldn't speak anymore. The thing that brought me my livelihood, I couldn't do it. And so we found out the schools would be closing. And so myself and two other moms that are part of my organization sat down, actually on a phone call, said, what can we do to kind of help out in this situation? And what was their response to disabled families and children? So if you have children who are disabled or they're being raised by elderly people who are at a high risk for getting COVID and also at higher risk for dying, how do we make sure that those children are safe and their caregivers are safe and that they're not out at the store trying to get food? And so on March the 16th, 2020, we started a food program. And it wasn't our first time in the food program, because I think a lot of people were like, oh, you decided to do it. And it was like, no. A couple years before, we had started a midnight meals with a message program, which was actually, we would go out into the most dangerous neighborhoods at midnight with food.
Wow.
And to hand out food in order for us to curb violence. And what happened was, while we were out there giving out hundreds and hundreds of lunches over 4 weeks, violence came to a halt in those areas.
Wow.
Because we were meeting people where they were and giving them what they needed. And so we would have these box lunches. And so, the whole idea of, I can go use my social media platform and say, look, we're going to be giving out lunches. I need some bread. I need turkey. I need apples, oranges. And I would come home and it would all be at my door. I would have, 50 loaves of bread and, all of this. And I had a refrigerator outside and people would put, stuff in the refrigerator. But
Wow.
I didn't have a refrigerator outside till somebody brought one here. I came home and there was a refrigerator there. And they said, well, you need a refrigerator for everybody to put stuff in. But so we started delivering food to disabled children, and families, so babies and brunch. Then we started getting calls from people whose children weren't school age, and they were having a really difficult time, because we have to understand how difficult a time it was for us to maneuver around. It still is.
Yeah.
For poor people to maneuver around in COVID, because if you had COVID and you had to be in the house, how are you going to get the food that you needed to your families? So the whole thing is, we don't want you out mixing with everybody else and giving it to them. And so we went from delivering every single day, and then we started having like more restrictions. The restrictions were, unless it was like work related, people couldn't be out. And so we took that from like every day to twice a week, and then biweekly, and then it was a month. So we would send out a month's worth of food at a time with a menu to families. And I would prepare a hot meal that would go into these meals also, or we would have local chefs. They would prepare hot meals. And we ended up sending out between March 2020 and 2021, 200,000 meals.
Wow. Wait a minute. So and actually before we started recording, I told you this, I said, you're like the Mother Teresa to me. You are like the one in the street that like gets it done, and how you rally other people to do it. So, this is a definitely like your unique qualification, your special power, if you will, is that you said, listen, I have an idea. I need to feed these people. Well, you're right. We don't want them out here, and they need to get food, and we've got to do this. How do we can't just leave the people behind. Right. So you went from there to saying, all right, we got to get some food out. And remind me, you took a small amount of your own money, right, to get this kind of kicked off, because you said, I've got to do something.
It costs $10,000 a month for me to send out food. And so for me, we always battle, what our purpose is in our head. So, God gave me a plan. He said, go use your credit card. I'm like, no, go talk to somebody else about their credit card. And it was like, use the credit card and you're going to get it back tenfold. And I'm like, no, I'm not putting this on my credit card. And I put it on my credit card, and we've been rolling ever since.
Man. And you got a refrigerator delivered. You put out the word to all the supplies that you needed, and look how you have created such impact just in terms of delivering food and providing just the basic necessity that somebody needed. That is amazing. Let's talk a little bit about
PPE.
Right. I know.
And PPE, dishwashing liquid, hand sanitizer, wipes, everything, laundry detergent, air fresheners, Easter baskets. My brother made Easter baskets all night for 125 kids. And then I went on Easter, started off early in the morning and hand delivered an Easter basket to every single child.
My goodness.
Most of them didn't, and the baskets had books in them, so we had, people who actually donated books. We had friends that donated food. We had, it was, community coming together for the better of community. Like it was a time for us to look beyond ourselves.
Yes.
And, and so for us, what we looked at is, since then, donations have dropped like 90%. And that's because now people are like, people went back into the thick of it. They went back to work. They went back into all these other things. So they forget that there's still needs out here in the community.
I'm so glad you said that, because that's exactly where I want to go. So let's talk a little bit about that. Let's talk about how someone can get involved. Let's talk about all the different, the different ways that they can get involved with you and your organization. My goal here is just to shine a light on what you're doing, to learn and hear from like the real world humans who are actually out here doing the work, right? You're doing the work and making the impact. You're not even saying, hey, come join forces with me, which I'm sure you would love. You're like, I just need the resources to accomplish this mission. So how do people get involved with your organization? What are you working on right now? If someone wants to make a donation, I know you do pledges, and as like little as like a couple cents all the way to like $1 million, if anybody wants to give, just saying. So
Oh,
tell us a little bit
that would
about
be a life changer.
tell us a little bit about what you're working on right now and how we can get involved with that. This week's episode of the High Achieving Female Podcast is brought to you by the No Global Membership. It's time. Get in the room to network with women you want and need to know. Link to join the membership is in the show notes below. And don't forget, you can also claim your freebie today.
So we've been working on our COVID relief, our vaccination clinics, also hosting clinics for the community. We've also been working on diabetes workshops. Like right now, we're working on, we have a focus group tonight on the glucose monitoring devices, trying to get those into the hands of community members who need them in order for their glucose to be monitored. We've also been doing healthy food and healthy menu options, looking at talking to our legislators about making sure that our children that are in our schools have healthy menu options and that they have them also at restaurants. And so looking at the amount of sugars, the amount of salts that are in our food and drinks that we're serving our children, working on dental access. So we've been working on dental access because a lot of times what happens is because Medicaid is slow pay and low pay, a lot of our children have never been to the dentist because a dental visit, if I try to make a dental visit today, I may not be able to see the dentist until like next April.
Wow.
And so we're talking about a lot of children who are not able to see the dentist, and we're supposed to see the dentist every 6 months to get a cleaning exam. And so some of them have never seen a dentist. So working on that. We also working on a no menthol campaign, talking with people about the dangers of mentholated cigarettes. And first and foremost, our biggest thing is the biggest public health crisis that we have right now is lead poisoning here in this area, and the impact of lead and what lead does to children over the course of their lifetime, because lead goes from your blood to your bones and then to your bloodstream. And so what happens is lead doesn't end because you're a child, is when you get older in life, lead poisoning causes hypertension, it causes you to have dementia, and it causes other issues that we have later. And kidney failure is the number one issue around lead poisoning. And so we know in the urban areas, we see a lot of people that have kidney failure, and it's directly related to the fact that they're being poisoned for their whole entire lifespan. And so working on environmental justice issues is important to us. Working on food insecurity issues is important to us. Working on reproductive health issues is important to the Northeast Ohio Black Health Coalition. Working around heart disease and, the things around heart disease, strokes, diabetes, all of those things are interrelated, and working on those. And then working to address cancer and the impact on the African American community. So anything that disproportionately impacts the community, whether it's something that we're doing a research project on and helping to bring people into the fold to get their information about how to make it better, or if we're just doing community work, community services work on, that is the work of the Northeast Ohio Black Health Coalition. We do a lot of good work. You can look at our website. It's neoblackhealthcoalition.org. So neoblackhealthcoalition.org is our website, and it has like all of the great things that we're doing. It has ways for you to donate. And ways for you to get involved, so you can become a member of the Northeast Ohio Black Health Coalition, and you can help us to help push these initiatives, because I can't push it by myself.
That's right. Let's talk about, I think this is a really important topic. Let's talk about your budget versus a budget like maybe like a mid-large size. Okay, let's talk about, because the dollars that people are donating to, it's going. It's not paying massive salaries to your huge team that you have, right? Like it's you and like a small core group of people. Talk to me about how you differ in terms of the money going directly to the causes, how much it costs to run the programs, and really what you need.
So the the last thing I meant to say is that I also teach a grief recovery class for people who've experienced grief. So I'm a grief recovery specialist, and so I teach a class, an 8-week class for people who are going through and really need some help. That, and then a pregnancy and infant loss group. So I do a support group for people who have had a miscarriage, stillbirth, or had a child die before age 1. And so we do that work, but so our work So I have myself, I have 2 staff, and then I have literally hundreds of volunteers who come and help me out when I need them. Everybody doesn't concentrate on everything. People pick out what they want to do, and those are the things that they help with. I have a Teen Truth campaign that we work with teens to teach them about advocacy, and they'll actually be here tomorrow doing yoga, teaching them how to do soil samples and other things. So our salaries are not like, we don't make these extravagant incomes. And probably about less than 20% of our budget goes to salaries, and then the rest goes to like all of these other things. Like for the
Wow.
teens that are coming, we pay them to come learn. So they get paid $50 to come to every group that they come out to, because we understand that if we put money into their pocket, they can go buy the things they want. They can go to the store, they can go buy clothes, they can help out with things at home. And so those, being able to have unrestricted dollars, besides our grant dollars that we have, the unrestricted dollars allow us to have salaries, allow us to be able, like, so the funding allows us to be able to have salaries, to be able to do the things that we're doing with young people. Restricted dollars, which are grants, they don't allow us to do all of those things. So they just allow us to be restricted to whatever piece that we're doing. So I hope that they gave a better understanding about how money comes and flows.
Yeah, that was great. And really what I wanted to get across is that 80% of what's raised is going back into the street. I mean, more than 80%. And that's critical. And that is so important for anybody who is wondering. And I understand that you will take whatever, however much. And I think, what I have to say is, like, sometimes when we're looking to get behind a cause, we want to follow an activist, follow a leader, a humanitarian, a researcher. And really that's you, from humble beginnings to doing everything that you can to impact the lives of the people in Northeast Ohio. I mean, it's amazing to see it. And I am so excited to continue to follow your journey and all of the things. I know you have a huge crowd. You are changing legislation. You are speaking. You are going all over. Can we talk just briefly before we wrap up a little bit about you, Yvonka? What are you doing? What are you working on next? And how can we support you?
I think our things right now is, trying to grow this, our Teen Truth campaign, to work with our young people, because we see so, like many other urban areas, we see a lot of issues that are going on around violence in our young people. And so for us, I take it personal. Remember, my brother was 15 years old when he never came home from school. And so because I take this personally, I work from that vantage point. Is like, it's personal. For the 3 staff members that we have, our salary, our whole entire salary is less than $200,000 for 2 PhDs and myself, for us to work for an organization. And so if you look at that compared to other organizations, I know a lot of CEOs that make 10 times more than that, just in their own salary, not, salary staff. But I think, for me, I am a mom. I am a grandmother. I'm deeply impassioned and ingrained in social justice initiatives. The plaque on my wall across says, I'm an activist, I'm a leader, I'm a speaker. I am an advocate, and I am a philanthropist. So, but I want to say the biggest part of me is that I am an agitator, because one of the things that we know about washing clothes is if you put your clothes in the washing machine and the agitator doesn't work, your clothes won't get clean. So we need people like me in order for us to be able to help change the dynamics that are playing out in people's lives all over this country. And we need people like you. And so, I think, we have to have agitators. We have to have
100%.
100 women, to know in America, in order for us to help change how we live, work, play, and pray.
Absolutely. I'm so glad you said that. And you are an agitator. You are doing some very Very, very hard, but very exciting work. And I just want to, again, I'm honored to know you. I'm thankful for what you are doing to impact those. You're not leaving any person behind if you can help it. And I think it's amazing. Tell us how we can follow you, how we can, again, give us your website again. We'll put all of this into the show notes so people will be able to click right on it. But how do we get involved?
So they can reach us at NEO. blackhealthcoalition.org, which is our website. They can reach us at neobhc@gmail.com, which is our email address. They can reach us on Facebook, Twitter, Instagram, by clicking in Northeast Ohio Black Health Coalition, and we'll come up. Or if they just are looking for Yvonka Hall and just to see the things that we've done, if they click in Yvonka Hall, the original, if they click in Yvonka Hall, the information will come up about our organization.
Amazing. And it's also my understanding that now that COVID is kind of moving past us, you are available to travel and to speak and to share on these initiatives that are like crippling our society and our neighborhoods. So people can.
Yeah, I can. We actually do this effectively engaging the African American community, the art of community engagement, because there is an art to engaging the African American community. So I do that talk all across the country.
Amazing. Well, I'm definitely bringing you in for that one. So thank you so much for being here today. Thank you for sharing just a snippet of your story and your mission. It's never enough time. So I encourage anyone who's out here listening that was compelled or moved by anything that Yvonka Hall is doing, please follow up with her. Do put your money on the table and send it over to her. She needs it, and she needs our support too. So again, thank you so much for being here, and I cannot wait to chat with you again.
Thank you so much for having me. I truly appreciate it.
Thank you for joining us for this episode of the High Achieving Female Podcast, powered by No, where we believe it's time for high-achieving women like you to be seen, heard, and recognized. Until next time, remember, you deserve to be known.